more than ever needs to be brought to light. If you ask the average teen about mental health, chances are they aren't really comfortable having a conversation about it, especially in ethnic communities. That might not sound like a big deal, but when you consider the fact that 1 in 5 teens live with mental health conditions and less than half are receiving the support they need, this absence of conversation becomes a significant problem. The fear of being viewed as different by their friends and peers is a large barrier to young people receiving mental health services. Moreover, it may not be well received at home due to the stigma, causing more harm than good. To help us begin a community conversation around these issues, we have 3 guest speakers with us today. Dr. Kusro Arastu, a practicing adult psychiatrist that provides crisis intervention for the DoD VA via telepsychiatry. Mr. Asif Zaidi, an educator, speaker, and author with a background in education and business, and Ms. Hira Hyder, a Toronto-based journalist, writer, and motivational speaker. In the first portion of this discussion, I'll ask the guests individual questions that are specific to their expertise. And in the second half, we'll have a Q&A where people can ask questions they want answered to the panel. If you want your questions to be asked, please send them anonymously via the Zoom chat, as we have turned off mic and video so the discussion can run smoothly and there's privacy. So first and foremost, I believe in order to address something, you must understand what it is. So I'd like to ask Dr. Arastu about 1, which mental health disorders are most often seen in children and teens? And 2, what are the top forms of treatment for these conditions?
Thank you, Fatima. This is an amazing initiative, and I hope you continue to do this. So I'm sure it's going to help so many people.
Inshallah.
So, inshallah. So I'll answer the question. I think before I start the diagnosis, I think the number one thing I want to put up there is stress, which is not a diagnosis or a disorder, but stress literally leads to everything else. So, and there's so many other causes that stress young teens and young adults. So the most common diagnoses are depression and anxiety. And depression in its mildest form, and just anxiety in its mildest form. But then severe depression can lead to a lot of problems, including lack of pleasurable activity, to life is not worth living sort of stuff. And then the severe forms of anxiety leads to panic attacks and just your social phobia and just being frozen sort of, socially and professionally. So, and then there are a few other common disorders seen in this age group, which is substance abuse. I want to put it up there. It's a big problem. Sometimes we don't see the elephant in the room. So, and the biggest substance of abuse is caffeine. And then comes nicotine, marijuana, which is THC, and opiates and benzos and stimulants, and the list goes on kind of. A lot of these are you started experimentally or innocently or just to cope up with stress, or and then it leads to bigger problems. And then one thing I'm very interested in, psychosomatic medication. The body bears the burden. The stress, this doesn't always translate to psychological symptoms. It translates to physical symptoms. Headaches, migraines, heartburn, irritable bowel syndrome, and in older folks, other issues too. So that's another thing. And stress, lack of sleep, stimulants, and other combination of things can unmask major psychiatric problems like psychosis or latent bipolar disorder. So that's something we need to be aware of. And then there is a big attention deficit and focus issues too. So these issues, you're coping with work and, stress and everything, you kind of burn out your cognitive reserve. So then you have trouble focusing and paying attention to what you're doing. A lot of people seek medication or self-medicate themselves. And this is a little overdiagnosed, so I just wanted to throw it over there, and then there's the autistic spectrum disorders, which a lot of young adults are doing fine. They go unnoticed in really the mildest form of the spectrum. But when they're transitioning into high school and college, these things become a problem. So it's good to be aware about the mild form of autistic spectrum. The severe forms are very evident, and they are already taken care of. And then the most important thing is suicide, how we prevent it. It's a sentinel event, and it's the second most leading cause of death in that age group, first being accidental death. So it's something that's completely avoidable and preventable. So we need to address that. So how do we prevent or treat some of these psychiatric illnesses? So the first and foremost is identification of the disorder and getting the proper diagnosis. Then processing the stressor or the conflict that's leading to these various diagnoses we talked about. Sometimes just taking a step back and rebuilding your cognitive reserves and putting some things off your plate will take care of the stuff. And then sometimes you need counseling, professional help, supportive therapy to really address the issues. They can give you coping skills, problem solving methods, and sometimes you have more severe issue like what we call cognitive distortions, like generalizations, catastrophization, and all these things. So a little more advanced form of therapy called cognitive behavioral therapy may be helpful for that. So again, being mindful about minor substances, avoiding caffeine, getting a good night's sleep, physical and social activity, all these with life changes can make a big difference. First and foremost, you identify the problem and problem solve it. So, and then lastly, it's medication. I'm not a big pusher for medication. I think it's the last resort. Too much of a tag with it, side effects and other issues. But there are a lot of good medications. If it's needed, it's needed. So it's like somebody's diabetic. You need insulin. You need it. So there are a lot of medications that can be used. Most commonly prescribed are called SSRIs or serotonin reuptake inhibitors, and they do help. So I don't want to go into the mechanisms of it. They're fairly benign and useful. I would avoid stuff like stimulants and anxiolytic medications like Xanax and all, which have a place. Sometimes it's a really life-saving, literally, to use these kind of medications, but that should be the last resort. And then finally, making sure the parents and the children and the friends and peers, help build a support system around themselves and keep each other in mind, build a support system, and then work with a safety plan. So that's in a nutshell about some of the diagnosis and treatments.
Thank you so much, Dr. Arastu. I understand this is such a broad spectrum of topics that have so many things that you could go into, and I appreciate you taking all of those and condensing them into a discussion that we could have here. Now that we have a good understanding of some of the most prevalent mental health issues and treatments, it's important, I believe, to understand that many people with serious mental health illnesses are challenged on multiple fronts. On one hand, they struggle with the symptoms that result from the disease, and on the other, they're challenged by stereotypes and prejudices, as you've mentioned, that results from misconceptions. So I'd like to turn to Mr. Zaidi and ask what is your best suggestion for destigmatizing mental illnesses, especially in the ethnic community?
Thank you very much, Fatima, and assalamu alaikum. Good afternoon, namaste to everyone. I've been told to speak in English, but I can answer questions afterwards in Urdu, Hindi, or Punjabi if anybody wants that. So coming back to destigmatizing mental illness, look, first thing is to talk about it, to make people aware like we are doing right now. But just talking about it will not do it. It is how we address mental health as a society and with our children. So we all know that some of the common public stigmas that surround mental health are that people with mental health disorders are weak or lazy, they are prone to violence, they are incompetent. So what all that conduces to is that the people with mental health illnesses are reluctant to seek treatment. Destigmatizing starts at the family level. And then we take it to broader levels, so the level of society or the organizations or the educational institutions. So what families can do to end mental health stigma is to talk about mental health in the right way. Look, it's important to talk to your children about mental health because if you don't, they will get the information from someone or somewhere else. And that source may not be reliable or accurate. For example, these days, one of the most common ways children are exposed to mental health is through media or social media, and those depictions we all know aren't always accurate or favorable. They can paint characters struggling with a mental health disorder as incompetent, violent, or whatever negative way. But on the other hand, when parents and children have an open and honest conversation about any topic, including mental health, children feel comfortable coming to their parents, which is a source that is they can ask, they can trust without being judged. So it starts with educating ourselves and our children about mental health. When it comes to education about mental health, we should all know two basic things. One is that mental health disorders are treatable. So when parents frame mental health disorders as treatable conditions, children can start to feel more hopeful about seeking treatment. The second thing is that mental health is part of overall health. It's nothing that needs to be stigmatized. Children know that they need to see a doctor when they have a headache or an illness or an injury. The same is true when they struggle with mental health or one of their friends does or one of their siblings does. So you have to educate yourself, our children and others about symptoms of a variety of mental illnesses like Dr. Kusro spoke about, because the more we know about mental illness, the less scary it seems. And when children see or hear others, for example, a celebrity or someone in our social circle, they hear about them suffering from mental health, we should talk openly and honestly about it because it gives our kids a better context for the topic. One more important thing that we can do to destigmatize is to explain mental health as a continuum. So when you talk about mental health as a continuum or as a range, it helps others identify with those who are diagnosed with a mental health condition. You know, for example, everybody feels sad from time to time. This is normal. Sometimes more than at other times. Everybody feels tired sometimes inexplicably so. So explaining something like depression on a continuum, on a continuation of that normal situation, it turning chronic, that helps children see the people with depression as being like us. They aren't different from them. And then you can lead by example by showing your children that when somebody is diagnosed with a mental health disorder, it is important to show solidarity with them. So when I say solidarity, mind you, I talk about empathy, not sympathy. So empathy is when you let people who experience a difficulty or a mental health conditions know that they aren't alone. When you hear about messages of people recovering from mental illnesses, share those, propagate those, because the messages of recovery are among the strongest and most hopeful tools in removing stigma from any disease, any illness. Then one more thing that we can do to destigmatize is to encourage, don't leave it to them, encourage friends or family who need it to seek treatment. Nobody should feel any need to hide their mental illness or substance use issue, for example. You can explain to them that once they seek help, it will improve their chances of living happy, healthy lives. Quote examples, real life examples. One very important thing that we can do to destigmatize, it is that we must never label people who have a mental illness, never. When we speak about a mental health disorder, we separate the person from their diagnosis. We don't say he is bipolar or she is schizophrenic. People are people. People are not their illnesses. People are not their diagnoses. We can also say that he has a bipolar disease. He's a bipolar disorder, sorry. Or she has schizophrenia. So this is known as person first language. It is far more respectable, for it recognizes that the illness does not define the person. And lastly, if you sum it all up, the best thing that we can do is the best thing that human beings have always done or ever done, that is to be a role model. We can all model reducing stigma through our own comments and behavior. We can politely teach our children, and not only children, friends, families, co-workers, others in our sphere of influence. So basically, changing attitudes takes time, but repetition is the key. We have to keep repeating it, keep getting the word out to bring about a positive shift in how we treat others, how mental illness is viewed within our family, within our bigger extended family, or within our classroom, or within our society. So those are the few things that we can do. Thank you.
Thank you so much, Mr. Zaidi. I'm going to move to Ms. Hyder now. And because we've just discussed mental health in the community through, I believe, an adult's perspective to a parental perspective, it's essential to discuss it within the home as well from a youth perspective. So the single age-old social precept of log kya kahenge, so what will people say, suppresses the much needed psychological care, as Mr. Zaidi mentioned, especially in the ethnic community. Many people feel that if their vulnerabilities become public knowledge, it'll lead to judgment and gossip. So I wanted to ask you, as a youth who has often advocated for self-care, mental wellness, how can someone who feels pressurized to hide their mental health and struggles due to this precept find confidence to discuss it without feeling shame?
So I wish that I could say at this point that, it's just mental health illnesses which people want to conceal within our Desi community. However, unfortunately, people in our Desi community even want to conceal their physical ailments. There are so many individuals and families who I know during a pandemic who are hiding the fact that they have been tested positive for COVID. And it struck me that if they're embarrassed to say that, yes, we've been tested positive for COVID, or let's say they've been diagnosed with cancer, God forbid, I wouldn't wish that on anyone. How difficult would it be to admit or to accept the fact publicly that, yes, I am a patient of depression, or yes, I am a patient of anxiety? So I think there's a stigma overall when it comes down to being healthy in our Desi community. And I think it's about time that we start voicing ourselves and admitting to the fact, accepting the fact that we are mortals. There are going to be ailments that will happen. We're not infallibles. There are going to be issues that will be happening in our life that will affect our mental health. So that's the first and foremost point that I would like to bring forth. Secondly, the thing is that not everybody is fortunate to be raised in a household with as dynamic as our two other speakers are right now, and they have full awareness. They're professionals. I'm sure the way that they deal with their family's mental health well-being, it's completely different to how a very regular individual, a regular adult who hasn't been exposed to this as much, this topic, would deal with. So I think it starts from childhood first and foremost, that if your child, for example, if they come to you crying, you don't tell them that you're a big boy, you're a big girl, why are you crying? No, you validate their emotions. You accept the fact that they are upset. You build a bridge of communication with them that what is it that is bothering you? That is going to not only create a platform of building emotional intelligence for that child, but it will also encourage them to express their feelings. Also, another thing that I strongly feel is that there are some individuals who are deemed to be very strong. They're very brave, they're iron. Nothing can ever affect them in such a way. However, behind the scenes, the way that they break down, the way that they endure that emotional and mental trauma that they have to go through every single day, they're doing it alone. Why? Because they're embarrassed of asking for help. Why? Because they do not want their image to be shattered, that I'm the one who's supposed to be the brave sibling, or I'm supposed to be the one who is the courageous daughter, or I'm supposed to be the friend who everybody comes to. How can I break down? So when somebody who is apparently extremely strong, if you know somebody like that, you have to be very much aware and keep a check on them. If you see that they've dulled down a little bit, have your red light go on and immediately check in on them. You don't have to go like, oh, are you okay? Are you depressed? No, you can ease into it. Are you okay? I don't see you active as much on social media. I just want to check in with you. You know, these are little things that allow an individual then to open up, to express themselves. So this is also something that's very much vital. And as far as the log kya kahenge thing is concerned, I really wish that people would think more often, ke Allah kya kahega. You know why? Because we have a duty to our soul, to our body, and to our mind. It is an amanah that Allah has given to us. We have a duty to it. We have to take care of it. So at the cost of what will people say, you're not going to therapy, you're not admitting that you have a mental health issue, you're kind of doing injustice to what you have been blessed with, right? So this is also a factor. And now that I kind of have brought in the spiritual element to it, I also want to put forth that there are also a lot of spiritual individuals out there who seemingly are very inclined towards their spirituality, towards their faith. And sometimes they feel a lot of shame that how can somebody who is as strong as us in our beliefs, how can we go through depression? How can we go through anxiety? But I would like to put forth that one of my favorite Islamic scholars, Sheikh Azhar Nasser, the way he addresses mental health is absolutely beautiful. And he very clearly says so, that just because if you are going through depression, anxiety, or any kind of mental health illness, it does not mean that your faith is at a low. You can have the most spiritual and strong in faith individuals who are struggling with this. So it's something that happens, just as a physical illness will happen. So I think that is the core fact that we all need to keep reinstating, not just verbally, but mentally to ourselves as well, that yes, it can happen and it's okay.
Thank you so much, Hira. From your discussion and bringing into spirituality, it makes a lot more sense that you shouldn't look at just other people. Look at yourself, look at your spirituality. And I think that also makes it hard for people to want to reach out, because they're like, what if I'm not spiritually able? Like, they'll start to doubt their own strength in the religion or in whatever spiritual a facet that they have. And from the discussion, I want to go back to Dr. Arastu and talk about one of the main themes I think that have been discussed is the importance to address the gap between diagnosable mental health disorders and those who are getting those treatments, because there's definitely quite a disparity. So I wanted to talk to Dr. Arastu as the medical professional. What are some of the challenges you have noticed that contribute to that gap in your practice?
Thank you, Fatima, and very eloquent discussion from our other two guests. And I think it's a very good point about destigmatization and also creating awareness. And then also the part about introspection and using spirituality, which are very powerful tools we can deal with. But I want to, like, we discussed some of the diagnoses, we discussed some of the treatments. Also, we need to do some root cause analysis, go down, where is it coming from? So is it coming from just a genetic or a hereditary type of mental illness, or is it coming from intrapsychic conflicts? There are so many things young adults are dealing with: cultural conflicts, religious conflicts, home situation, home culture, all these things. And there's a major physical transition here. It's a big phase transition. The growth hormones are playing a big role. They're coming. They are literally coming of age, from a child to an adult. So all these identity development issues are there from an intrapsychic level. So then there's a major shift in learning from a high school where education comes to you, and you're going to college where you go to the education. You have to literally seek out. So it's a major paradigm shift. And there is a little bit of separation anxiety. Not everybody is as excited to go to college. Even the most excited kids, there is a little bit of a separation anxiety from a comfort of the home to a dorm, sharing a room with some other completely unknown kids sometimes. So these are some of the coping skills and things the young adults are going through. There's also there's a psychosexual aspect, which I think a lot of people want to look the other way. There's a huge surge of hormones. There's a humans and have this incredibly high procreative instinct, so young adults, boys and girls, they're dealing with hormones. And then how to curb this flood of hormones, you have some expectations socially and culturally, you have to put a dam. So that can cause a little bit of psychological stress, So, and then the barriers of what we are talking about, a lot of people think I can do it myself. That's coming from, so it's not easy sometimes. And you don't really see yourself, so you don't know how far along you are. And then the parental part, things will get better soon, they'll just look the other way. So both ways, it's not good. So keeping an open dialogue at home, being aware and discussing is a really great idea. Sometimes a dinner table conversation could be very helpful for like parents identifying. We get very busy. So, and then dealing with shame, guilt, and taboo of mental illness is one barrier. There are also some physical and logistical barriers too. Getting to the right professional. Distance could be an issue. Time is a major issue. Everybody is busy, parents and children, either in careers or studies. So you don't want to take time out for mental illness. And money could be an issue. A lot of us have even great insurances, but then we still have to make co-payments and this and that. So that sometimes comes in the way of procrastinating help. Then there's generational gaps, cultural gaps, and immigration gaps. Immigrant parents, like me, tend to be very driven, and we expect a little bit more from the children, and we think they are having it very easy. But you have to really understand. It's totally different examples here. What you went through for immigration is different from what they are undergoing. And then there's also first generation Americans versus second generation, or first generations in the West. So first generation have coped with a lot of these skills with their parents and with their culture. They have really made an impact, and they're good, successful people. And then they have different expectations from their children. Sometimes it's a very interesting thing. First generation immigrants can be a little liberal. The first generations are very religious, and they kind of go a little extra, and then the third generation comes back to a little bit balance between liberalism. And so I just wanted to throw it out there. So what are the goals of all these? So we have to make sure we address these things. And how do we address it? Being aware of the warning signs is very important. And then if there is a family history of mental illness, you have to be even more aware, and then look into these things. Getting timely help and the right kind of help is important. What do these do? Basically improve the quality of life, improve your coping skills, and bring out the best in your cognitive reserve, so you can be your full potential, self-actualize yourself. And then not only that, you prevent severe mental illness. Sometimes things just go downhill and spiral down. You don't want to go there. So sometimes it's a point of no return. So, and then avoid addictions. A lot of people turn to self-medications, from caffeine to some severe. So this is a big thing. Rather than self-medicate yourself with stuff, you get the right medications if you need to. And then lastly, you prevent hospitalizations and nervous breakdowns, which is the extreme form. And then the most sentinel event is suicide, which is so preventable and so unfortunate if it ever does happen. It's very devastating to everyone around. So I think these are the main goals. So we have to keep in mind and work towards that.
Thank you so much, Dr. Arastu. That's beautifully put, how there are so many disparities, and especially now because of COVID, there are probably even more so because people aren't able to go out and get the help that they need. And there are higher numbers and chances of people with anxiety and depression that might cause more of a gap that you've discussed, and more reason for there to be disparities. So I'm just going to move on to Asif Uncle and ask, Mr. Zaidi, and ask him, how can educational institutions as well as workplaces provide mental health aid to the workers and students and close this gap and this disparity and allow people to get the treatment that they need, discussed by Dr. Arastu?
Thank you very much. Yeah, before I answer your question, I would like to compliment Dr. Arastu the way he explained succinctly yet comprehensively the individuation process among teenagers or adolescents was very good. Well done. Yes, you are right about COVID. It has been a paradox. On one hand, the COVID-19 pandemic has increased health awareness among public, reminding us of the need to go beyond the physical and to safeguard mental health as well. On the other hand, the pandemic has also entailed a mental health crisis. Many of us have been living with the fear of catching the virus. Many have had to care for sick family members at home. Many have to wait hopelessly, unable to visit sick family in hospital, including intensive care. Others have experienced the deaths of family or friends in a short period and without being able to help, without being even able to say goodbye often. Some have lost their jobs, their businesses, got their hours reduced. So we have all been living in uncertain times. Our routines have been disrupted, and we have had to cope with the rapid changes in our personal and professional life. So as you rightly said, all this has caused levels of anxiety, stress, depression, suicide, substance abuse to rise. Alcohol consumption has risen in Canada and in many other countries. So what can the workplace or education institutions do? Look, the way they can help is two-pronged. It is one, those who need to seek help, they should be educated and they should know when to seek help. And second, those around them, those managing them or teaching them should know how to help. So we talked about reducing stigma. We have to create a culture which is positive and where people are encouraged to prioritize their well-being at workplace or in the classroom. Then we have to be sensitive to recognize and appreciate that there may be community, religious, or cultural differences that affect people's choices or attitudes regarding mental health, illnesses, and treatment. So as Hira said, you have to validate their feelings and you have to hear their concerns. One thing that workplaces, the companies, businesses, or schools can do is to encourage managers and teachers to consider their word choices. Their word choices surrounding mental health, how we talk about it during everyday interactions is very important. Then we can encourage the company or educational institution leaders to start discussion about mental health, especially in the wake of COVID. It will be something that we will be coping with over the next 1 or 2 years. There will be an aftermath of that. And so one of the best ways is to encourage people to talk openly about it, how this pandemic, how the associated difficulties, traumas affected them. And then they can give employees or students access to education and resources. Teachers must know, they must be taught to recognize the characteristics of mental illnesses in students and to take action. That is important. They must know how to create an accepting and supportive environment in the academia. Because it is the studies prove that social inclusion, freedom from discrimination, fairness, access to economic resources, All of these are key reducers of mental health illnesses. And all of these help to prevent problems or reoccurrences. And then as teachers or as managers, people should be taught that how they are going to reduce the effects of mental health issues on a student's ability to learn or people's ability to perform. So for that, you have to provide opportunities for managers and teachers to attend relative training to support people living with mental health problems. We have talked a lot about that in Canada, and there is a number of initiatives, which for the paucity of time we can't discuss now, but that are being undertaken by the government. And help employees, students recognize when they need help. And the last bit, which Hira also talked about, was make care available.
Yeah.
It's not only that you approach people with potential mental health concerns with sensitivity, empathy, or understanding.
Yes.
You have to make care available, so make it affordable. So it has to be part of health benefit packages. It has to be part of insurance coverages. And then one thing that you can easily do, and we have spoken about that here, is that you have to provide screening resources.
Yes.
Employers and schools can look out for students or people who have some issues or doubts about mental health by encouraging their participation in free and anonymous online screening. That helps. So I hope that answers. Thank you.
No, thank you so much for your structured answer. We have more of an in-depth knowledge on the ways that we can improve how people get help. Lastly, I just want to talk to Ms. Hira, Ms. Hyder, and I wanted to talk about how you were discussing before about how mental health and mental illness can be scary, and how people have a hard time reaching out. And I wanted to ask, what would you say are some of the best ways to reach out to teenagers and adolescents, especially to erase the stigma of mental health, to increase the number of people who have a discussion and get the help that they need?
So first and foremost, I actually want to address 2 points. First point is that how people can reach out to the youth with regards to mental health.
Mhm.
So I always say this as a journalist, as a motivational speaker, that to all the bloggers out there who have millions and thousands of followers, you have a solid platform where you can speak up about those things which truly matter and which truly need to be addressed. If you are an influencer, then please influence people to do the right thing. Also, for those individuals who want to reach out, however, are a little skeptical, my advice is always that do your own research primarily. And because we are the youth and a lot of our media consumption is through social media, find the right accounts which are run by actual mental health professionals. There are a lot of free therapy sessions that these accounts follow. And I know Mashing PK, run by Hira Khan, she had found it such a brilliant platform that it's a platform for women by women. And they have a segment every week where you can have a session such as Ask the Therapist. So as a writer for that platform, I always advocate this little article that they put forth, and who knows that they're actually answering one person's question. However, it's addressing the questions and queries of 100 other people. So it's very important as the youth that the media that you are consuming, be very mindful of it. If you're not, it can take you down the worst road possible. Especially with the pandemic going on, everything is online, right? We're socializing online, we're creating content online, we're consuming content online. So make it a point that the things that you are putting into your mind is very much healthy, just how you're very mindful of what you put into your body. So it's also good to do social media detoxes. For example, if you are wanting to change the information that you want to consume, unfollow the accounts that are doing bad to your mental health, no matter who it is, and follow those accounts which are actually going to be doing good. Another thing is that when it comes down to media consumption, I cannot resist but bring this show up that was on Netflix. It was called 13 Reasons Why. And it addressed a lot of points that both our brilliant speakers have brought up. And it addressed the fact that it is very important for adults to be careful around their youth, in the sense that every individual who is struggling with their mental health will some way or the other, let a loose end go through. They will say something, or they will behave in a way that is kind of like a silent cry for help. They will. You have to be very careful. If you're a parent, it is your responsibility to keep an eye on your child, observe the patterns that are ongoing. If there's a little glitch, you have to kind of, sit and have a talk with them. With regards to teachers and counselors, you have to be very much aware of what is going on in a student's life. Because honestly speaking, especially in North America, what I have observed is that mental health issues with regards to substance abuse are far worse than they are in the Middle East. Because I was raised in Dubai, I went to school and university in Dubai. Things are different. They have their own set of mental health issues, which are at a peak. But in North America, I feel like, because obviously there's a culture of faith, a clash of, culture and faith both, that substance abuse does go to a rise. So also another thing is that for parents, it's very important to accept the fact that there are some things that you're going to have to talk about with mental health issues. Okay, there are a lot of core elements which contribute to it. For example, you have to talk to your kid about alcohol consumption. You have to talk to them about drugs. You have to talk to them about physical relationships that they can indulge in. Because until and unless you don't communicate with them, speak to them, they're not going to know. They're going to go out there, they will experiment, and then it's going to be a mess. So this is extremely important that, build a relationship of communication. And it's not just with parents. Being the eldest sibling, I have 3 younger siblings. I have always felt that it's been a responsibility as an older sister to take my experiences that I've had and kind of give my younger siblings the advice, the lessons that I have learned. So it all comes down to the fact that how empathetic you are, how emotionally intelligent you are, consciously trying to be, and speaking in detail about such issues. So yeah, just talk about it. I always urge this.
Thank you so much, Hira. That really, really helped, and it struck a chord with me personally as an older sibling as well. And it's hard to see people who are going through so many issues that don't get the help because they're not being talked to and they don't have a safe environment at home. So I think that's extremely important. Absolutely. So that's the end of the first segment. Thank you guys so much. Now we'll have questions from anyone who wants to message on the chat. Please feel free to message if you guys have anything you want to ask the panelists. I do have 2 or 3 that were personally sent to me. So while we're waiting for someone to message, I got one that said, why do you think culturally sensitive therapy is important? For anyone on the floor who wants to discuss.
Go ahead, Asif.
No, you go ahead.
So I think, yeah, culturally sensitive therapy is very important too, so that they have a background from where you're coming from. So I think that's a good thing. We didn't mention that in the treatments. Sometimes these are available through our religious centers, and not just religious centers. Like you said, culturally tuned to what your background is or what your parents' background is. So I think that's very important to gain an insight, and so that you can get the proper treatment. Thank
you. Does Mr. Zaidi or Ms. Hira have anything else to add on?
Yeah, definitely. I think it would be great to have something like that, because it's important for parents to understand why their kids are thinking the way that they are. And it's important for children to know why their parents are thinking that the way that they are, just so you have mutual ground and you can respect each other's individuality and your separate ideologies, which are, of course, from another era, from another land, another culture. So yeah, to build a non-hostile ground, such a therapy would be brilliant.
Thank you. So we had another question in, most children may not be comfortable discussing personal issues with Desi parents. How do we address that?
I would strongly say that it's a parent's responsibility to build that relationship with their child. And that relationship is not built when they reach the age of 13. That relationship is built from the age of like a year old. I mean, you have to let your child know that they can screw up and they can come to you. Till that is not built, then obviously it's very difficult for children to approach their parents. And that's why then they go outside of their household, and not everybody is going to go as easy on them as parents usually do. So it's a parent must make it a point to build that relationship with them. And all the young individuals who are getting married right now or who will get married right now need to realize that this is something that when you decide that you want to have kids, when you're taking care of their financial issues, when you're taking care of their physical ailments, you got to work on their mental health as well alongside. That cannot be overshadowed.
Okay, thank you.
Yeah, I mean, if the kids are reluctant to discuss with you, the responsibility lies with the parent. You see, if you're missing how your child takes in information, you will not be able to communicate with them. So that is one thing. First thing is that your child is for a different time and they speak a different language, emotionally as well as cerebrally. So as a parent, it is our key to figure out what language your child understands and then use it. That is one thing. Second, especially in our cultural backdrop, it is important to learn that we have to teach our children to embrace imperfection. You cannot expect to bring up a child who feels they are perfect and then come and admit their inadequacies to you. It doesn't work. So your children, you have to bring up to accept imperfection, their own and that of others. So that is extremely important. And thirdly, when Dr. Arastu was talking about the the individuation process, that happens a lot, especially when the genetic changes and hormonal changes start taking place preceding adolescence or puberty. You have to be very careful. You have to see if there is a sudden behavioral change in your child. You have to see if there are drastic variations in their personality. They have changed their friends. So all of this and all these or any other inappropriate behavior that continues to persist, you have to talk to your child and help them communicate. So it's a work that you have done over a period of time, but still don't expect your child to come to you. You have to be very vigilant, very watchful, and do not hesitate to seek help from experts or professionals. It's an important matter. Thank you.
Thank you so much.
I think those are really good points, and both putting the responsibility on the parents, and I think we need to develop as all immigrants and maybe even have programs to teach parenting type of techniques, how we keep open dialogue on the dinner table and other places. So that's a very good point about communication gap also. I should include that in all the other gaps, speak the same language, learn to understand their language, and maybe try to communicate to them in their language. And so that they don't feel brushed aside or rushed or chided or judged, all these things will make them recoil, so I think that's a very easier said than done, but I think it's a very important thing to look into it.
Thank you. So we had another question. How do you identify when professional help is warranted once you identify a mental disorder in your family? And where should we start with professional help?
I think Dr. Arastu is best equipped, and we can, if we can add anything, we'll do it.
For sure. Dr. Arastu, the floor is yours.
Yeah. So what was the question again? I'm sorry.
How do you identify when professional help is warranted? So once you identify a mental disorder in your family, where should you start with professional help?
Yeah, I think firstly, identifying a problem that something's wrong here and the mood's different, somebody's more withdrawn, their grades are dropping. So then your red flags are up. So, maybe first talking to a counselor and trying to figure out where it's coming from, trying to do that root cause analysis and identify where the problem is coming from. And then maybe then next step would be to go to a psychiatrist or something if needed. Is there a medication? I feel as a psychiatrist that we have a gatekeeper role. First of all, a lot of people come to us first and from other channels. So you identify if it's a social issue, you identify the social issue. If it's a chemical issue, take care of the chemical problem. Maybe it's a thyroid problem, and make a referral to the internist. And then, or if it's a psychological problem, you refer them to a psychologist. Then if everything is all squared, then you jump into prescribing medications for them. So I think, so there's a step process, but maybe going to a counselor first would be the best thing, and they would be able to identify where it's coming from, and they would make the right referral.
Thank you so
It
much.
could be a student counselor or a professional therapist, or, so.
Yes, in terms of identifying, I will add that, look, you have to be very vigilant. The two biggest indicators in children of mental health issues are found to be antisocial conduct or risk-taking behavior. And then you have to be vigilant, you have to proact in the sense that if your child is going through a stressful period, or there is sudden changes in environment, they have lost their friends because of change of a school or country, or they have academic inadequacy because of lack of command on language, or they have feelings of lower self-esteem because other kids are different from them and they have problems in social interaction. So you have to look at all of those, or most of those things pass away with parental intervention and their help. But if they persist and they distill into red flags like weight gain or loss, or difficulties in sleeping, or sudden changes in friends, or, especially preoccupation with death, or talk or jokes about suicide, the way your children talk betrays their personality. So you have to be very vigilant how they are talking, what they are talking about, the vocabulary they are using. And if they get into trouble with law, or you see signs of use of tobacco, alcohol, or drug, lack of sociability, these are all clear identifiers. Many people miss these.
Thank you so much. I completely agree. So we have another question. It's often said that therapy can go two ways. Sometimes it helps certain individuals and sometimes it actually worsens their mental illness. Why is this so, and what creates this difference?
Dr. Arastu, please.
Yeah, sometimes therapy is usually helpful, I think, just to be able to bounce off some things and learn some coping skills, identifying cognitive distortions, which I call like generalizations, catastrophizations, and those things. But sometimes therapy can be not very good. It's usually the therapist or the dynamic between the therapist and the person seeking help. So it's good to go to somebody you are more comfortable with. So I personally think therapy may not be detrimental really, but it may just be the dynamic between the two. And I think if you don't get along with somebody, or if you don't like their personality style, it's best to seek a different therapist. And I do believe sometimes, there are things that get created in therapy. We're bringing out false memories and all these things. Those things are definitely out there. And iatrogenically created multiple personalities. That's I feel it's like dangerous grounds. But I would say pretty much most of the time therapy is good, and if needed, and then at least to identify, get some supportive, and have someone to be your sounding board.
Yeah, I think very good point from a layman's point of view. Uh, therapy, sometimes it doesn't work. There are a number of issues because many people see it as a panacea, which is it isn't. It is a mode of help, and they still have to work on themselves and do what they are told. So sometimes they do not do their homework or behavioral changes that are required, and then it's difficult to blame therapy. One point that I will add to Dr. Arastu's erudite answer is that sometimes it's the therapist that is not working. Not everyone is best suited to one therapist. So I have seen that sometimes there are cultural issues, there are religious issues, there may be some issues. We all understand some cultures better than others. A therapist who has administered therapy to 1,000 people from one culture will be much better attuned with that culture than to someone that he is completely stranger to. So that is something that needs to be, before concluding that therapy isn't working, that is something that needs to be looked at. Sometimes you need a change of therapist. Thank you.
Thank you. So we have a question. Some people hesitate to see psychiatrists because they're scared of this affecting their medical and professional health records. How do we deal with this problem?
Dr. Arastu.
I think that's a pretty genuine question. There are certain jobs where you have to have clearance and other stuff, So particularly a lot of the DoD jobs, with the Department of Defense or government, you need a psychiatric clearance. So that stigma of a psychiatric diagnosis can affect, but I think that shouldn't really deter treatment. You can get a letter from your psychiatrist that you're safe to perform whatever duties. I have people who carry weapons and they're on medications and they're actively seeking help. So, and from law enforcement to, active soldiers, so that's, I trust them with their weapons too, so, hopefully nobody goes postal, but that's a different story. But I think it's important to get help more than be worried about stigmas, and there are always ways around it.
Thank you so much. We'll have maybe two more just to keep it short. Thank you all for your questions. Mental health has gone down the drain because of social media and how people compare each other's lives and pictures. So how do they handle that? Hira, Miss Heather, could you please take the floor?
Yeah. So I always have this quote that I put forth again and again and again, that be unapologetic when you are sharing your life's battles, because we're all in it together. All of us. There is something or the other that is wrong in each of our lives. And many of the times I've seen that Alhamdulillah, I have a big social circle, and there are many different kinds of people in that social circle. And as a life coach, whenever somebody approaches me with their problems, especially close friends, I'm there for them. I hear them out, and I know the deepest and darkest of their secrets and their problems. And then a couple of hours later comes the best social media post. And I'm in shock, and I'm like, whoa, I'm like mind blown. I'm like, was I talking to the same person whose pictures and videos I'm just seeing right now? So the thing is that social media, it's a circus. I mean, it depends on how you want to be a part of that circus. Do you want to be the ringmaster? Do you want to be the lion that jumps through the hoop? How do you want to be present? So when you see something on social media, do not believe it to be 100% true. And that is why I personally make it a point to share my life struggles and my life's battles, which I have done throughout my entire journey. Because when people see that, oh my God, she's a journalist for Hum TV Canada, great family, great friends. Oh my God, she's got everything together. Not really. There are a lot of elements to my life which I have struggled with, and that's why I put them forth. Because as an influencer, I hate that word, but I guess I'll just use it. As somebody who does influence individuals, who is a public figure out there, and who has a responsibility to her audience, I make it a point to let them know that not everything that you see on my social media is my whole life. Apart from that, again, bringing a little bit of a spiritual element. I always say this, that the Almighty has blessed us equally. Something that I have, you may not have. Something that you have, I may not have. You know, one half of the world, when it is dark, where there is no daylight, the other half does. The other half is full of sunshine, full of brightness, full of hope. But then you know what? It rotates. So just because you're seeing somebody have a really great day or a really great month or a really good phase, it does not mean that they have not had dark phases where they have been miserably crying in their bed or have been patients of depression or anxiety. You know, so this is something that's very important to continuously say to yourself while you are on social media. It's difficult because when you are in a rut, especially during this pandemic, and when you've just lost your job and you see that somebody is soaring in their career amidst the pandemic, you just feel like, I'm not good enough, I'm not doing enough, you know, what's the point? I've lost my job, they're doing so well. These thoughts start to come to your mind. Or if you're in your late 20s, how I am, there are many young girls as well as guys. You're scrolling through social media, you're not in a relationship, you're single, but you don't want to settle down with somebody. 3 posts of people. Someone from school just got engaged. Somebody from university just got married. Oh my God, my childhood best friend is having a baby. I'm sitting here, I'm single. However, they are the ones who look at your life and they go like, you know, look at this girl's life. Look at this guy's life. It's perfect. I wish I was in their place. So this conflict, only you can help yourself. Only you can sit yourself down, speak to yourself and say that, you know what? They're having a good day, I'm having a bad day. It's going to switch around. The blessings are going to be equalized at some point or the other. And who knows, just before they posted that great grand birthday surprise of theirs, they were literally on the verge of a divorce with their life partner. You never know. You never know. So do not compare your life, because social media is not reality. It's very essential to keep saying that to yourself like a mantra.
Thank you so much. That really resonated with me personally as well, as someone who is part of the youth and also scrolls mindlessly and feels extremely attacked by all these brilliant things other people are doing. You have to remind yourself that you're doing great things. You're on your own schedule. You're on your own timetable. There's no timetable for success. You're on your own lane. You're not in like multiple lanes.
Everybody has their own individual journey. So you focus on yours.
For sure. Thank you so much. So I'm just going to have one more question. Thank you, everyone, for sending them in. I wish we could go through all of them, but I don't want to make this too extremely long. So I got this in. As someone with a mental illness, I often get brushed off in conversation with, you know, let's talk about it later. It seems like you're having another episode, which can be quite frustrating. And it feels like my mental illness is being used as a weapon to shut me down. How can I combat this?
Before anybody hops in, I think that such an individual is quite toxic. Whoever you are in a relationship with, may it be a sibling, a friend, or a partner, this is highly toxic behavior. If an individual truly loves you, cares for you, respects you, they will acknowledge your mental health just as they would acknowledge your physical ailments. So it's very important to detox your life from these toxic individuals. It's difficult. Sometimes these relationships are deeply rooted and they are for years on end, but you have to do it for your own mental health. And I've always said this, that once you clear the negative energy, more room is made for the positive energy. So, I'm sorry for whoever has said this. I feel so sad that, you know, you're having to face such a toxic individual. I'm sure you must be a brilliant human being, but find yourself better people.
Thank you. Mr. Zaidi or Mr. Dr. Arastu, do you have anything that you wanted to add on just before we wrap it up?
I think we're good.
Okay. Thank you so much to the guests, Dr. Arastu, Ms. Hyder, Mr. Zaidi. Thank you so much for being a part of this important discussion. And I hope, inshallah, we have many more. And thanks to all the people who are live right now with us on the Zoom call and who had sent me so many questions that I wish I could get you guys to answer every single one of them. I really appreciate the time everyone took out to be a part of this and to raise such an important issue and bring it to light, especially in the ethnic community that we live in.
Thank you. And Shumayl, Hasan, I think you've done a great job, and may Allah reward you for this. And it's like your quote on that thing, it's really profound. We hear about the other side of the ayat, where if you kill one person, it's like you've killed humanity. It's also, if you saved one life, it's like you've saved all of humanity.
Yeah.
It's such an important thing, not just save one life, save the quality of one individual's life, and not be a toxic influence or a doorknob for them is so important. Jazakallah.
Thank you. Any last comments before we end the call?
Just thank you for having me. I mean, I've learned so much through this panel myself, and I know that I'll be using a couple of things when, you know, people do approach me. I've learned so much, and I think adults such as our professionals here should have
100%.
social media accounts. The youth needs you. Trust me, the youth needs you to
100% agree.
create videos, to create posts, to just get all that advice that we need. So please, please take the initiative to do so.
Jazakallah, everyone. Thank you so much for being a part of this. And the recording will be up soon once it's edited with all of your discussions within. Thank you so much. And Allah Hafiz.
Thank you.
Thank you.